Introduce you to Katherine Young. You are a breast cancer survivor, also a podiatrist in Stockton, and you're a survivor for 10 years. October, of course, Breast Cancer Awareness Month. Very nice to meet you. You wanted to, I guess when you were diagnosed, you faced some challenging choices, and one of them was to either have chemotherapy or not. Tell us a little bit more.
Well, I found my breast cancer in 2003, and I had to decide whether I was going to go on chemotherapy or not. I had already gone through double mastectomies with reconstruction.
Okay.
And I wanted an alternative, so my husband and I started to research, and he found an article in the Wall Street Journal, and it talked about this new test. This test was called Oncotype DX, and what they do is they actually take your cancer receptor sites from your genetic test and put it on your tumor, and they can tell you what kind of recurrence rate you're going to have, whether you can metastasize, and also whether chemotherapy is really going to help you. And in that test, they found that 94% of stage 1 and 2, no negative, estrogen positive patients really don't benefit from chemotherapy. So although I had seen 3 different oncologists, they all wanted me to go on chemotherapy. I worked with a doctor. He and I did the footwork. He checked with all the experts and found that this genetic testing was very accurate.
Wow,
so
that is
I became
amazing.
the first person to have that.
Really? In the whole United States?
Yes.
And the success?
The success, well, the standard of care is now all around the world. Before, they just check women for the size of their tumor, their age, and microscopically on the outside. This tells you about the genetics inside.
Okay.
And therefore, I had it done in 2004. I went back to the scientists there, and they said the test would be exactly the same. It showed that because I had a low score, I wouldn't benefit from the chemotherapy.
So what type of treatments did you have then?
I was put on the oral pill, tamoxifen, and also Remedex for 5 years.
Wow.
Yes, and I didn't have to go through that.
So tell me what it's called again.
It's called Oncotype DX, and if women are interested, they can go to mybreastcancertreatment.org and get more information.
mybreastcancertreatment.org.
Right.
Do you think that some insurance is covered, or is it an elective?
Oh, yes, we worked very hard to get it covered, and now support groups that I've been to, everyone's been covered either by their insurance or we have plans that will cover you if you need financial help.
So wonderful. Right. Thank you for coming by and sharing that with us. I know you're very busy this weekend, and congratulations. Very healthy.
Well,
everything good?
Thank you.
Fellow survivor. I always love meeting my sisters now for life here. Thank you so much.
Okay. Awesome. Thank you very much.